So care coordination in its broadest sense is about communication. It's communication between providers, settings, patients and families, and different service delivery.
So care coordination in the outpatient setting, we really kind of work on keeping patients out of the hospital, preventing readmissions, especially in the 30-day time period post initial discharge, which is where a lot of organizations run into lack of reimbursement, is in the 30-day time period. So really working with those patients to make sure that they have adequate resources, also medical management as well of chronic diseases.
And you're helping facilitate what the patient and their family need from this experience. But ultimately, as with all nursing, you should be working yourself out of a job, meaning what does the patient need, how do they become independent, and ultimately your goal would be for them to receive the services they need, be able to take care of themselves without your day-to-day or moment-to-moment interaction.
Absolutely. So it could be anywhere from setting up home services, and maybe home care nursing or aid services, in-home occupational therapy or physical therapy, even outpatient as well. And then sometimes just medication resources. It could be as far as providing education to a patient on their medication, or assisting them with finding a financial means to pay for their medications as well.
So if you're talking about people in the hospital setting or acute care setting, those care coordinators are mostly interested in what happens at the point of transition back to the community. If you talk about independent care coordinators, case managers, or you're talking about care coordinators who work in providers' offices or primary care, they're probably the most fundamental form of care coordinators, in that they take care of that meta level of care coordination. So they're not setting specific, is what I mean by that. Mm-hmm. So care coordination is actually a fundamental part of nursing, and all nurses at some level do some form of care coordination. And then there are nurses who have the job of care coordination, and they do it much more broadly, and that they interact more intensively usually with settings, or they're prepared primarily for some major activity like transitioning a patient or chronic disease management. And we no longer have the number of care coordinators who work with those populations of patients. So that falls back on the healthcare system to try to close that gap, and usually acute care is the one that bears the burden of that.
I think a lot of it is just kind of trial and error, and kind of making connections with some of the different resources that we utilize. We actually frequently kind of reach out and search for things on the internet for different resources, but we do have a foundation of resources that we're very familiar with, or we've always found if one resource isn't quite what we need, most places are very helpful about providing a different resource if that isn't quite what you need. I have a patient, for instance, when I first met her, she was having a lot of social and medical issues going on, and was actually very dependent on her medical team, just nearly for daily things, to keep track of her appointments, transportation, and those sorts of things. And we worked with her nearly on a daily basis, and once we were able to support her and show her what she was capable of, she's actually done quite well, making appointments for herself, setting up her own transportation. She's been more compliant with her medications, and is just continuing to work on her overall health and wellness.
So we're looking at developing a master's for care coordination. It's not a nursing specific master's degree, but we anticipate that the majority of people who will be interested in it will be nurses. So what we plan to do is offer it campus-wide to people who are in any healthcare discipline. So it could be pharmacy, PT, OT, social work, nursing. Physicians potentially would be interested. We're just now putting the curriculum together, but we're hoping probably in the next year to have something up and running.
I think it's going to take off quite rapidly with the current population that we have that is aging and the rise of chronic disease at this point in time. I feel like it's actually something that's very necessary for organizations to kind of start to look at and try to integrate into their own primary care practices. I even think at times that even some specialty care practices could benefit from having a care coordinator on the scene as well. But I think as time goes along, especially over the next few years, I think institutions will start to, kind of jump on board even more and start bringing in care coordinators into primary care.
So this program is very important in today's healthcare scene in that we need to be able to manage patients and help them navigate the system of healthcare from acute care to after hospital care to home. They need to have a care coordinator, if you will, who's able to help them with everything from management of medication, management of their treatments, but also being able to help them with navigating the complexities of their insurance and so forth. We need to have case managers to be able to be sure that people get placed after acute hospitalization into the right after acute care settings. So some need to go to rehab, some may need to go to a nursing home. So it just depends on the state of the patient. This is a new program that would be able to attract lots of graduate students who either have a background in nursing or may not have a background in nursing, but it's going to enable them to have the competence and skill to really help coordinate care, and especially throughout a hospitalization and especially at discharge. So we have a school that's always been avant-garde here. That's what's the next new thing in terms of healthcare demands, and how can we meet that demand by preparing a practitioner who's part of the team, who's going to contribute to the team, and ultimately improve the health and well-being of clients, of patients who are the object of our care. So this is a really important initiative.